Okay, well, hello and welcome to the UC Center Sacramento Speaker Series. We're glad you could all join us today. This is the third talk of this winter quarter, continuing with our 2021-22 theme of emerging from the pandemic, promoting health and prosperity for all Californians in the wake of COVID-19. Well, as many of you know, UCCS is a system-wide program of the University of California whose goal is to prepare California's future leaders and share knowledge to support public policymaking. This is a really busy season for us, and if you go to our website, uccs.ucdavis.edu, you'll see descriptions of some of our current projects, including emerging scholars who are graduate students who have shared their policy-related research with us, some of whom will be presenting in the next few weeks. The STEM Solutions Program, which is an opportunity for students to present legislative bill ideas, some of which may advance through the legislative process. And of course, our undergraduate program, where we welcome students from all over UC to participate in an integrated program of internships and academic courses. And many of the students are here with us today, and we welcome them as well. So now to today's topic, media, politics, and public health, reflections on the COVID-19 infodemic. Our country has not been this polarized, arguably, since the 1860s. And one would have hoped that responding to a public health emergency like a pandemic would bring us together, but it seems to have done just the opposite. Part of the problem is that different political groups seem to rely on completely different sources of information. Daniel Patrick Moynihan famously said, "We're all entitled to our own opinions, but not our own facts." Well, plenty of us, and I include people on both sides of the political spectrum, seem to think that we are entitled to our own facts, and that's a problem. But let's not blame the public, at least not entirely. Could it be that public health authorities share some responsibility for not communicating as clearly as they might? Well, here to talk about this and related phenomena is Susana Ramirez. Dr. Ramirez is Associate Professor of Public Health Communication at UC Merced. She has an MPH from Harvard and a PhD from the University of Pennsylvania. Her website calls her an infodemiologist, applying communication science to advance public health goals for rural and Latino populations. She's the author of many academic articles focusing on the influence of communication and culture on health and health disparities. Just a word about our format for questions. Please reserve your questions for the end, and then you can raise your hand and staff will call on you, or if you're unable to do that, you can enter your questions through the Q&A feature in Zoom, and we will try to reconcile those and read as many as time allows. So now, without further ado, please join me in welcoming Susana Ramirez. Susana.
Thank you, Dr. Kravitz, for that introduction and for the opportunity to be part of this webinar series. In case anyone is confused, I want to make sure to clarify that I'm not a medical doctor and I'm not an epidemiologist. I don't study infectious diseases, but I do have 3 degrees in communication, and I've spent my entire professional life trying to understand the ways in which access to information affects people's behaviors, and also the ways that kind of access affects the organizational and social context that constrain people's behaviors. So I'm going to talk about 2 main issues today, and I hope that by the end of my talk, you'll be convinced about the policy solutions that I'll propose. Before I start my talk, I want to pause to acknowledge that the land on which I am sitting today, which is in the background, is in what is present-day Merced, is unceded territory of the Yokut and Miwok peoples. So we pause to acknowledge all local indigenous peoples, including the Yokut and the Miwok, who inhabited this land, and we embrace their continued connection to this region and thank them for allowing us to live, work, learn, and collaborate on their traditional homeland. So now just take a moment of silence to pay respect to their elders and to all Yokut and Miwok people, past and present. So I know that this is not going to be shocking to anybody, that we all have access to more information than we can possibly consume each and every day. Our environments, even as many of us have been stuck at home for the majority of the past 2 years, remain cluttered with messages that have the potential to affect our health. So I'm talking about our email inboxes, the newspaper and the television stories reporting on the latest vaccine trials, the online ads that pop up when we're reading the news. And I'm also talking about the posts that you see on social media from your weird uncle or your high school classmates. In the past 2 years, we've also seen a spectacular blending of political and health information as key messages about COVID prevention and spread have been politicized. But before we get to concerns about misinformation and the politicization of information related to COVID, I want to just acknowledge that access to so much information might be problematic on its own, even without considering whether it's true or not true. So in a recent study about the effects of the information environment, I found that Latinas find health information overwhelming and confusing. And the quote that's on this slide is from a 19-year-old Mexican-American woman. She says, when you go on the news, well, they always say everything causes cancer. And then, I don't know, it's hard to believe, but they always come out like, don't eat this, it causes cancer, or don't eat that, it causes cancer. And maybe some of the things are true, but some of them are not. Maybe if it's on Facebook, I won't believe it, but I might if my doctor told me about it. And so this quote really illustrates the sense of confusion and frustration with conflicting information from different sources that many of the people in my study expressed, and that is really common among our population today. There's just too much information and it's confusing. And the perceptions that people feel about there being so much information that much of it contradicts itself and seems confusing has at least two negative consequences. So first, this perceived conflict tells us something about whether people are going to trust information sources. If you perceive the information environment as consisting of contradictory knowledge, that can engender mistrust in public information sources for health information. And this mistrust can have long-term consequences when public health professionals need to partner with the media to disseminate critical health information, like in the current pandemic. So we have this situation where we have so much information that is relevant to health. We perceive that kind of information as being overwhelming, confusing, maybe some of it contradicts itself or it seems to be contradictory, and you don't trust those sources. And when you get to a pandemic where we have to use the media to disseminate information quickly to broad swaths of people, but they don't trust those sources, that's problematic. So that's sort of the first consequence. The second negative consequence relates to health outcomes. When people perceive that there are contradictions, when there are real contradictions reported in the news about scientific advances, these contradictions really sow confusion about what's the right healthy course of action. And this confusion could lead to inaction or to just rejecting the advice on the grounds that it might change in the future, just like the prior messages have changed. Even though I've just said that people feel like there is too much information and they feel very overwhelmed, there are still really essential information gaps. So in my own research on cancer and nutrition communication, I found that people are very overwhelmed by what seems to be constantly changing guidelines about what to eat or to do to be healthy. And this feeling of overwhelm isn't really helped by the amount of science that keeps happening, keeps getting reported on, and seems contradictory. But even despite feeling like there's so much information, people still feel like they lack access to the right kind of information. In the nutrition context, as an example, they want specific information. So how do we operationalize the basics of eating healthfully? For example, how do we make healthier choices at the grocery store? And how do I balance a concern for my health with other essential demands like my budget and the time that I have and the skills that I have to prepare nutritious foods? So when I talk with young women about the choices that they make and how they make choices about what to eat, they practically beg me for advice and training on skills. So I mean that they really don't know how to cook healthfully. They didn't learn at home and they don't know where to look today for that information. It may be that they're suffering from analysis paralysis or information overload, that they have so many choices about where to look that they just can't focus. But we are not doing a very good job as a society of helping young people develop skills to discern which sources are trustworthy and how they can narrow their search for the information that they want. And I'm going to come back to this point in a little bit. So why does the information environment matter for health anyway? One hint that I said already was that eventually public health officials need to disseminate information about public health pandemics and such. But kind of more generally, there are two developments that have happened in parallel. So one of these is the proliferation of information that's been available to the everyday person over the last 2.5 decades. So as I've already said, the sheer amount of information that's available today can be problematic. But coupled with this proliferation of information, there's also been a deliberate shift in the medical establishment, at least in the US context, to empower patients to become joint decision makers with their providers. So even as we have more and more information available to us, we are, as patients, required to make sense of that information in order to stay healthy. I'm not going to comment on the merits or demerits of the patient empowerment movement, but I do want to be really clear that that paradigm presupposes and requires that people have access to the right kind of information when they need it, and that they have the skills to make sense of it. So just think about what this means for your own life over the past 2 years. In the COVID context, we've all been asked to make decisions that affect our health. Should we be vaccinated or not? Should we get boosted or not? Which vaccine to select if we have the choice? Which is the best mask to use in what context? So these factors, these are decisions that we make for our own health and also to protect other people's healths, amidst the backdrop of an enormous amount of misinformation, disinformation, and just so much overwhelming information. But like other, what we call in public health, social determinants of health, so all of those things that aren't biologically or individual choice dependent, access to information and people's ability to make sense of that information is socially patterned. What I mean by that is that even though in general, it's true that most of us, and probably everybody who is on this webinar, have access to too much information, the kinds of information that we have access to differ based on our social position. Not everyone has access to the same kinds of information or even the same quantity of information that has the potential to affect our health. So for example, as a university professor, I've had the privilege of sitting at home for most of this pandemic, consuming a steady media diet behind a computer every day, where it's literally part of my job to keep up to date on the news related to COVID. And I'm able to access expensive subscription-based news and scientific resources as part of my work environment. But for many of the most vulnerable populations, including the majority of essential workers who, by the way, in this state are Latinos, the information environment looks rather different. For starters, they don't have access to unlimited sources or to news anytime that they want to access information. And one thing that we've learned throughout this pandemic is that many of the most vulnerable members of society, who are these folks who don't have the same kind of access to information, are those who are doing the most critical work of, for example, keeping our food system working. Where I sit in the Central Valley, workers and other workers in farm and meat processing companies have kept working throughout this pandemic to keep us all fed. And these folks are not just getting infected and seriously ill and dying at much higher rates than whites, but they also live in regions that can be characterized as information deserts. So in one study that I did in this region, we found very little health information available, period. And then within that limited set of information that was available, there was virtually none that was available in Spanish or any other languages. And so you can really think about, if they're not getting information that they need and want in the language and that, accessible to them here, where are they going to get that information? And yet these rural areas where we have geographically dispersed populations are precisely where media might be especially critical. But besides that, just access to the information, it might not be available in the language that people need. So we know that there's not nearly enough information that's available in Spanish in general about any kind of health related issue. But at least with respect to Spanish, we talk about that a lot, and we sort of recognize that a large portion of our population speaks Spanish as a primary language. And we see some evidence that health organizations are trying to catch up with that. But we actually have a significant number of indigenous people in California who do not speak Spanish or English. And so their information environment is very limited and filtered through the social connections that they have who might speak English or Spanish. We also, in addition to the linguistic challenges, we also acknowledge that many of the most vulnerable people have limited literacy skills, having received very little formal education. And yet, by and large, the people who write communications write for other people like them. So they are dense and they use complex structures, and we're talking about things that are hard to understand as it is. So that limited literacy is a problem. And this is one that's particularly significant for, again, most of the essential workers. The pandemic, though, has also forced us to communicate about and as individuals, making sense of risk. And this idea of risk really involves a complex calculus of values, what we think is important in life, but also of numeracy, or what we call literacy about numbers. And Americans in general, across the board, have exceedingly low levels of numeracy. So as an example, basic tests show that just 13% of Americans can be considered proficient in quantitative literacy. And proficient in quantitative literacy was assessed as correctly computing and comparing the price per ounce of food items at the grocery store. So you go to the grocery store and there are two different brands of a box of pasta. The quantitative literacy assessment asks you to compare the price per ounce of each of these two boxes. And just 13% of Americans could correctly do that. And that's it's a complex task, but it's a relatively simple cognitive task that really doesn't have very much value laden into it. And so when you think about the idea that just 13% of Americans are proficient at that, and then you layer in the values and the worries and the stress that come in the context of an infectious disease pandemic, very complicated. Structurally, we also see that the healthcare system rewards people who are proactive seekers of information. So those people who are actively talking with their doctors, are engaged, they have a doctor that they can see and they're engaged with that communication, they are rewarded with answers to their questions and access to treatments or prevention. But research shows that health information seekers are disproportionately white, college-educated women. So structurally, we see some disparities as well. In addition, Latinos, African Americans, and Native Americans face barriers to accessing the healthcare system. They're more likely to be uninsured compared with white Americans, and they're disproportionately clustered in low-wage jobs that leave them with meager financial resources to pay for healthcare. They are not covered under their employer plans, et cetera. And these same groups, Latinos, African Americans, Native Americans, tend to live in neighborhoods and communities that are segregated and underserved by medical professionals. And then when they actually overcome all of these barriers to obtain medical care, they face discrimination that leads to poor treatment and often communication barriers. So these are also really essential barriers to understand why potentially some of these discriminatory experiences and the structural barriers result in Latinos and African Americans disproportionately relying on health information from the media. We know that no matter what people say, they are in fact looking for health information from the media. And Latinos and African Americans, for these structural reasons, tend to trust and rely on this information more than the general population. So in these ways that I've just laid out, we can see that the information environment is structured differently for different groups of people, and that these differences are part of what's contributing to worse outcomes among marginalized populations. So where does that leave us in the COVID era? Well, over the past few years, we've become very familiar with concerns about the legitimacy of the news. If you'll recall, there was a time when we didn't say fake news, but that use of that term really has contributed to concerns that originated among certain segments of the society, but are increasingly reflected in dialogues of people across the political spectrum, and have even penetrated the media itself and what they say and how they cover information. In May of 2020, the Director General of the World Health Organization raised concerns about the infodemic that was spreading misinformation about the pandemic just about as fast as the COVID-19 virus was infecting people. That summer, the World Health Organization held the first global meeting and training in infodemic management, recognizing that the flood of information about COVID was making it hard for people to find trustworthy sources and reliable guidance when they needed it. The WHO further acknowledged that the spread of misinformation and disinformation complicated the challenge of managing a highly contagious disease and added complexity to the emergency response. And in the 2 years that we've been living through this pandemic, it's become clear there is no question that misinformation and its sister, deliberate disinformation, are real threats to public health. These are growing problems as information is increasingly used as a political weapon. Spreading misinformation sows confusion and doubt in people's minds about the issue, and even more problematically, potentially, for the very notion of what is information and its relationship to freedom and democracy. Just last week, Pope Francis spoke up about the infodemic, speaking to the International Catholic Media Consortium on COVID-19 vaccines, which is a fact-checking network that aims to combat misinformation. The Pope claimed that being fully informed by scientific data is a human right. And so he talked about the infodemic spreading. This is 2 years after the pandemic started, where the leader of the world's Catholics, many of whom, in the US context, span the political spectrum, is concerned about the rise of fake news, and really stating clearly that information is a human right. So misinformation, deliberate attempts to seed disinformation, to put falsehoods out. I don't even want to repeat some of the things that I've heard as potential cures. I don't want to contribute to the disinformation problem, but I want to acknowledge that those are very real and legitimate concerns. But I also want to urge us to be really cautious about how we talk about misinformation. We can't let concerns about misinformation shape the conversation about the allocation and resources that are needed to combat this epidemic. So one of the challenges that journalists in particular continue to face is distinguishing between misinformation, what is real misinformation, and why certain populations, or what certain populations believe that might in fact be misinformation, versus the preferred narratives that reduce public health issues to individual responsibility concerns. And so the only way we're going to get out of a global pandemic is to think about it like the global health issue that it is. So as an example, when we talk about vaccination rates being lower among certain groups, we need to be really clear that there is a difference between those who are vaccine hesitant or opposed to the vaccine because they may have been exposed to and believe certain kinds of misinformation, versus those who have low rates because of structural issues that limit their access to the vaccine, it isn't hesitancy or skepticism, for example, for a worker who earns an hourly minimum wage to avoid getting the vaccine because they're concerned that the time it takes to travel to the vaccination site and the time that it takes to recover from side effects of the vaccination would mean losing out on income that they need to cover their rent and their groceries. That the solution here isn't that we need to focus on removing disinformation and misinformation. It isn't better communication about vaccine side effects. It's recognizing that there are side effects and to provide or to advocate for governments to provide the material resources that people need to overcome the challenges associated with the side effects that they're concerned about. So I want to be just really, even though I come at this from a communication perspective, and I think communication is the cause and solution to all of the ills in the world, there are in fact limits to what communication can do. And often what I have seen in the last 2 years of public conversation and narratives, by focusing on misinformation, we potentially obscure very real equity issues. And I think it's important to point that out and to ensure that we are not doing that. So nonetheless, there are specific COVID-19 information disparities. And this goes back to what I mentioned earlier, that much of what the information that we need to overcome in the context of COVID-19, the real information, the misinformation, the confusing information, that even trusted, reliable sources are not helping me out trying to decide which kind of masks I should wear, right? Because there's so much confusion, and the KN and the KFs and the 94s and the 95s and it's all much information. But even if we can think about not just the access issues, but the disparities that exist in the structurally different ways of the limitations that people have in making sense of risk, right? So we go back to thinking about how hard it is for people to understand numbers, and then layer in an understanding of numbers when there are real consequences to your individual health or your family's health. The idea of risk in itself is rather different for scientists who are reporting on risks, and the way that you and I as individuals understand risk and make sense of risk in our daily lives. They're really different, and we're not good as a human species at making sense of that, at translating from what the scientific risk is telling us to how that should impact our daily lives. And we haven't seen leadership really doing a good job of helping us think through that. All of the information isn't all bad. Some of the factors that contribute to the infodemic can be useful as well. One of the main sources of the toxic infodemic has been the role of social media. Early in the pandemic, I published a framework to help guide the investigation and assessment of the effects of social media on public health. We called it the sphere continuum, and we really took the parable, if you will, of an infectious disease model to think about what are the different roles that social media might play. It is true, no doubt, that because of social media and the networked connections that people have, that information has spread, misinformation has spread too much. On the other hand, there are really good media testing sites. And so it isn't, although I've outlined all of these disparities in access to information and the ability to make sense of that information, on its own, it is sort of neutral. And so you can think about this conceptual model that we published to guide the way that you think about how social media might play, the role that it might play with respect to population health. This is pretty depressing, all of this. So in the last few minutes of my talk, I want to actually turn to positive recommendations. So I want to make some policy and funding recommendations for folks who might be despairing. What can we do about the way that information is unfairly distributed and that misinformation is spreading? So there are a few things that we can do. One is we need to encourage better translation of science. And to do that, we need to empower our journalists, who are the key translators of science from the scientific community to the lay publics, right? So we need to do a better job of training them. And I am so pleased I had the opportunity to collaborate with the Latino Cancer Institute, who last year put together a media forum for journalists. It was a series of webinars that each set featured a number of scientists representing different areas that might be relevant to the pandemic, to dealing with the pandemic, and connected them with journalists that primarily serve Latino communities, with the understanding that these are the journalists who are lacking resources. They aren't necessarily, when they work for small local news organizations, they aren't necessarily dedicated to the health and science. These aren't the journalists who are most experienced at interacting and translating science. And they don't necessarily have the connections, and in many cases in the communities that they're serving aren't necessarily connected with a university that has access to scientists. So the goal of the media forum was to create those connections, provide learning opportunities for journalists. And I thought it was a fantastic media forum. We had some good feedback. We didn't have a formal evaluation of it, but this kind of initiative where we are providing direct access to scientists for the journalists who are providing resources and serving as the communicators to groups that are disenfranchised and may not have access to the experts that you hear on CNN, for example, that might have access to more local experts to cite, I think is a good framework for thinking about how do we get essential information in more easily digestible ways to non-scientist audiences. So that's one option. But we can't say it's only the journalist's fault. Journalists are doing the best they can, given what they're trained to do. A lot of the problem with understanding the confusing nature of the pandemic is the fault of the scientists. We are not trained to do science communication. We're not trained to talk to other people. Scientists are trained to talk with each other, and they use lots of technical language. They use language that you and I understand as, in layperson terms, but means something very different in a scientific context. And we're not trained to communicate with non-scientists. And so if we can do a better job of training our scientists to speak to regular people as well, and to connect them to journalists and to other people who can help them do that communication, that's one of the approaches that we can take. I love this quote from a book called Making Data Talk. The media will do science better when science does the media better. And this image that you see of a fortune teller is a little bit cheeky, but it's because 40%, when they wrote this book, 40% of people in the United States believe that astrology is scientific. It's not. And 45% of people believe that antibiotics kill viruses. So you can see that there is there's room for improvement in how journalists communicate science, and that when we do a better job of training the journalists to communicate science, they'll do a better job of translating it for their audiences. But also the scientists need to be better prepared to talk to non-scientists. There's another group that really also needs to be involved in conversations about translating science and for health equity, and that's community-based organizations who are generally doing really fantastic work in their communities and are able to tap into what are the community's concerns, what are the resources that this community has, but could use training on harnessing the power of the media to advocate for those resources that they need. So conducting spokesperson training, where you actually bring people in from the community and you help them write opinion pieces to submit to newspapers, to practice talking to journalists about the community's experiences, so that there are specific areas that you can talk about, that specific talking points, 3 talking points that you can have for every time that somebody asks you about your community. That's another kind of intervention that we have some evidence. These are effective strategies, but aren't nearly as prominent or prevalent as could be. And then all of this, all of the challenges I think that I've outlined with respect to information and the way that people make sense of it really come down to the low levels of media literacy and science literacy. And so when I think about science citizen training for the adults who've already gone to school, there are specific things that we can do to help people understand how to make sense of the media, what different forms of media are trying to do, and how they're using their technologies, their algorithms, their fonts to persuade you in a particular way. Also how to understand science. But I think at the bottom line is we need to do a better job from the time that people are in school, right? So we need to ensure that our educational systems from the beginning are really providing these these skills that are very much essential in the current moment. So with that, I think I've left time for questions. So I'm happy to, I'll pause and take questions now. Thank you for your time.
Oh, right. Thank you so much, Dr. Morris, for just a fantastic talk today. And so with that, I'm going to go ahead and have Brooke pause or stop the recording.